Next up is Dr. Karl GOLNIK, and he's going to be speaking on really hot topic, which is AI to facilitate teaching and assessing.
Thanks. And I just wanted to add one thing. Another good practice is having that audience response system allows you to see if the students know the answers or not. So I use something differently. It's called Slido, no financial interest. And I tell them they have to write in the answer, so instead of multiple choice. And if you don't know, just write don't know, because it's anonymous. I don't know who said, but then I know no one knows the answer. We're going to spend more time. Or everybody knows the answer. Okay, next question. And so it's a great way to get that interactivity during the session. And you know, there's always someone saying, raising their hand with the right answer if you don't have, and you know they know the answer, but you don't know about everybody else. So the audience response makes it interactive and gives you information about what the class knows. All right. So AI to facilitate teaching and assessing. I unfortunately have no financial disclosures. My objective is to describe several ways AI will enhance teaching and assessing. And as you might expect, there's been a huge increase in publications in AI and medical education, and this is just a graph of that going on over the last, since 1992. And it's all sorts of different types of topics in this review article, which I recommend. So performance analytics, chatbots, clinical guidance, procedural guidance for trainees. There's all sorts of ways that it can be used in medical education. And because of all those things, I can't talk about all those in 10 minutes. I'm going to concentrate on 4 things, really. Simulation, virtual reality, creating cases with feedback, creating presentations, creating multiple choice questions, and surgical skill assessment. So the first 2 are kind of the teaching efficiency, if you will, and the second 2 are assessment aspects. And then I'm not going to cover tutoring system, virtual mentors, data analysis of past performance to see what the students are at risk or where their gaps are, but it can do all of those things. And before we start talking about it, I found this, and I can't remember where I found this, but before using AI for presentations, and I changed that, before using AI for anything, it does not replace sound educational activities and principles. Teaching methods must be good teaching methods, and importantly, everything you do requires critical review and adaptation of what AI is giving you. You can't just ask it questions and use what you get. You've got to have a content expert review it first. So here's an example of AI for creating cases. This is a chat bot that Eduardo Majorga from Argentina created. QR code will take you there. It's Ophthalmology Sim Patient Creator. And so it starts with, hello, I am Chatty, a chatbot that will help you discuss diagnosis and treatment of simulated patients. You just start by writing hello Chatty, or in whatever language you want to say hello, and you need to copy and paste the browser into the link, or the link into the browser, sorry. So you start, me, hello Chatty, and it responds, hello, on which topic would you like to create a simulated patient for you to work on today? You may want inspiration on the case. You may wish to present at iWiki, and a link to iWiki. You can request a case in any of the topics listed. Me, okay, a 33-year-old patient with double vision. AI, got it. Here's the initial presentation. 33-year-old male, double vision for the past 2 weeks. Please let me know if you want more details. Me, more details. I'm not going to read all that. So here's the more detail. So this takes, less than 1 second for AI to give me now this more detailed case presentation of this 33-year-old with double vision. And at the bottom it says, what would be your next step in the diagnostic process? Me, complete ocular motility examination. I'm a neuro-ophthalmologist, by the way. Aha, so here's the complete, relatively complete for this chief complaint of the ocular motility exam, and then the AI says, does this result narrow down or add any new potential diagnoses? What would be your next step? Me, MRI brain. Answer, here are the findings of the MRI brain. Does this result narrow down or add new diagnosis? What would be your next step? And so you get the feel for how this could be used for teaching. But the content experts got to look at these and make sure that it's giving you the right answers. So that's one way you can use it. cases. It'll simulate those cases way faster than you can simulate them. What about for presentations? And Gabby may be talking a bit about this. I only have a couple slides, but you can use it for presentations. Create a PowerPoint presentation on recent updates in the diagnosis of optic neuritis. And then it gave me, this is just the first slide, but it gave me about 10 slides about recent updates on here's the introduction. And I said, okay, well, that's kind of vague. Give more detail for each of the slides. And here's what it gave me for the introduction. Now, that doesn't mean I'm going to use this exact slide, but it tells me, it gets me started. It lets me adapt this and edit this to what I want to say. But it gave me all the other slides had much more detail when I said, give me more detail. So you can create PowerPoint presentations. You can create different, templates. It doesn't have to be black and white and so on. So you can create presentations. I would say a draft of a presentation, and you can ask the AI to refine it or give more details on whatever aspects you want. So 2 ways for teaching. Cases, it'll create, and PowerPoint presentations to at least get you started. What about for assessment? Well, people who write multiple choice questions, good multiple choice questions, know that it's difficult to write good multiple choice questions. I took a whole day's course on how to write multiple choice questions. You'd be surprised. And so oftentimes starting is the hardest part. Getting that first, okay, what's my question? Getting the answer, that's the hardest part. And so AI can be used for efficiency. So there is a chat GPT for generated case-based MCQs, starting by defining a topic and objectives, writing a prompt, review and refine. You definitely need to review and refine. So, for instance, create a multiple choice question on optic neuritis. Chat GPT. And I'm not going to read all that out, but okay, that sounds like a decent stem for the question. Here's what it gives us for the choices, which of the following is the most likely diagnosis. So this is all Chat GPT. And so you may want to look at it to make sure. Eduardo Mayorga, the same fellow I mentioned, who is more of an expert at AI than I am by far, sent me 10 questions like this, all created by AI. I knew they were because he's not a neuro-ophthalmologist. And about 4 of them were terrible, and I just said, don't even try fixing those. 3 were pretty good, and the other 2 needed a little revision. But I got 6 pretty good questions very quickly. You can also say, provide an explanation regarding your answers, because that's really where the learning part can come in. Here's the explanation from ChatGPT. Here's why that's the correct answer. So I'll let you read that very briefly, but as you can see, fairly detailed response. And please give me some references regarding those so I can make sure you're right if you don't know they're right. And here's what it gave me back for the references, proving that question answer actually was correct. And then AI for surgical skill assessment. So it can be difficult to review videos of surgical skill, and now they are using AI to look at videos and judging the surgical competence. The AI judges it, tells you back how you did at certain steps. This requires a lot of work, a lot of videos. You have to train the AI to do it. I'm not getting into any of that, but it is the future. I'm not sure it's the present. I think it is the future that AI will be able to judge video of surgical cases. So in summary, AI is going to have an increasing role in medical education. I think there's no question about that at all. But it can save time for teachers. But remember, and I have to show this again and again and again, before using AI for anything, follow these rules. You need to use sound educational principles. You have to have good teaching methods. You have to have a content expert review whatever AI gives you. And the educator's role is still key. It's just that AI hopefully will streamline what we have to do as educators, make it easier for us to teach and assess. And I thank you for your attention.
Can I ask you a question?
Yes, please.
Well, the ChatGPT for MCQs, Does it have a filter by which you can make a multiple response answer?
You can ask it to have whatever number of
Ah.
answers and or distractors and answers you want.
Okay,
Yeah.
all
Yep.
right, thank you. Any other questions to Dr. Karl?
Hi. Thanks, Karl. Amazing presentation. Just to go up that last slide, that warning about
Yeah.
being careful.
Yeah.
I did a study with my students a couple of years ago where we asked them to ask ophthalmic questions of ChatGPT, but the research wasn't about that. It was about the references. And we got them to check the references,
Yeah.
50% and fictional.
Yeah.
So,
Right.
but that was actually useful exercise for the kids because it made them realise, oh, okay, I can't believe anything.
Right.
But really, it's
So
important.
that's a very good point. Yeah. So you got to check the references because the references may not be real. So and that makes that may make it more work for you depending. But yeah, you got to check the references. You got to check everything. Yeah. Thanks. Yeah.
Sir, I use one EMR called New Chart, which has a AI assisted with EMR.
Y-
My ophthalmic assistant takes all pictures, OCT, fundus picture, whatever it is,
Ah.
and we transfer it to my AI, and it gives me the diagnosis, provisional diagnosis.
What was the?
Can you repeat that?
New Chart.
New chart.
Yeah.
Okay.
Just to transfer the
Sharing.
picture to AI, my AI,
Yeah.
it gives me the report.
Okay.
It's I can say 95% accurate.
Okay.
Wow.
Thank you.
Thanks.
So AI is a great tool, but there's so many other